Did you know that high blood pressure is a silent killer? And what can we do about it? Hello, my name is Molara Alexis. I'm a board-certified physician in internal medicine. Let's talk about high blood pressure and how we can address this problem. A normal blood pressure is considered to be less than 120/80. And why is it important to have this ideal blood pressure? High blood pressure is one of the leading causes or contributors to many of the chronic ailments that we see in our society. For example, elevated blood pressure can cause coronary heart disease manifested by heart attacks, and elevated blood pressure over a prolonged period of time can cause damage to the heart, leading to heart failure. Elevated blood pressure can also cause kidney disease, leading to end-stage renal disease. Elevated blood pressure can cause stroke. It can cause a reduction in blood flow to the brain, leading to what some people call mini strokes or TIAs, or it can also lead to a major stroke, resulting in significant mortality and morbidity. Elevated blood pressure over a sustained period of time can lead to visual impairment. So how can we reduce our risk factors for elevated blood pressure? Or if we have elevated blood pressure, what are some of the things we can do to help manage it? Exercise is an important activity. It is recommended that persons should engage in at least 30 minutes of activity for at least 5 days a week. Now remember, if you have some health concern, please see your healthcare provider before engaging in activity. 2, diet. It is recommended that we consume no more than 2,300 milligrams of salt a day. And for someone with high blood pressure, this number should be reduced, maybe even as low as 1,500 to 1,000 milligrams a day. It is very important that we read our labels. And so, salt is sometimes described or worded as sodium, MSG, soda. It is particularly important that we read and know how much salt we are consuming when we buy products, especially processed products such as frozen products, canned products, and all our sauces and condiments. These normally are notoriously high in their sodium content, in their salt content, so we must read to know how much sodium is contained in these products. One thing that we can do to help our food to become more palatable is to use a lot of fresh herbs. Garlic is particularly important and may have some properties to reduce high blood pressure. Lemons, thyme, onions, these help to give our food flavor and to reduce our dependence on sodium, on salt. A third factor that we can control is our weight. Let's work with our healthcare providers to ensure that our weight is ideal for our height. And we should keep in mind that as we exercise and as we follow a plant-based diet, this will also help us to control our weight and to ensure that we are at ideal weight, thus again reducing our chances of having elevated blood pressure. And finally, we would like to encourage avoiding or staying away from alcohol and caffeine. We find caffeine in products such as carbonated drinks, energy drinks, coffee, and some teas. So let's read our drinks and our labels carefully to make sure we are not consuming products that contain caffeine. They may help us stay awake longer, but they also increase our blood pressure. Hypertension is indeed a silent killer. However, there are things that we can do to address it. We can exercise, remember, at least 30 minutes for at least 5 days a week. Our diet, having a low-salt diet that is rich in plants such as fruits, vegetables, whole grains. Also, maintaining ideal body weight and staying away from substances like alcohol and caffeine. Let's take control of our health by God's grace and defeat this silent killer.